don't stop. Don't stop. Don't stop. Don't stop. Don't.
Chapter 136. Properties of nerve fibers. Excitability. Excitability is defined as the physiochemical change that occurs in a tissue when stimulus is applied. Stimulus is defined as an external agent, which produces excitability in the tissues. Different types of stimulus, qualities of stimulus and strength duration curve are explained in Chapter 30. Chronaxie is an important parameter to determine the condition of nerve fiber. Clinically, the damage of nerve fiber is determined by measuring the Chronaxie. It is measured by Chronaxie meter. Nerve fibers have a low threshold for excitation than the other cells. Response due to stimulation of nerve fiber. When a nerve fiber is stimulated, based on the strength of stimulus, two types of response develop: action potential or nerve impulse. Action potential develops in a nerve fiber when it is stimulated by a stimulus with adequate strength. Adequate strength of stimulus, necessary for producing the action potential in a nerve fiber, is known as threshold or minimal stimulus. Action potential is propagated. Electrotonic potential or local potential. When the stimulus with subliminal strength is applied, only electrotonic potential develops and the action potential does not develop. Electrotonic potential is non-propagated. Cathelectrotonic and anelectrotonic potentials. While recording electrical potential in a nerve fiber, two electrodes, namely cathode and anode, are used. The potential change that is produced at cathode is called cathelectrotonic potential. The potential that is developed at anode is known as anelectrotonic potential. Only the cathelectrotonic potential can be transformed into electrotonic potential or action potential. Action potential or nerve impulse. Action potential in a nerve fiber is similar to that in a muscle, except for some minor differences. Table 136.1. Action potential in a skeletal muscle fiber is described in Chapter 31. Resting membrane potential in the nerve fiber is 70 MV. The firing level is at 55 MV. Depolarization ends at plus 35 MV, Fig 136.1. Usually, the action potential starts in the initial segment of nerve fiber. Properties of action potential. Properties of action potential are given in Chapter 31. Electrotonic potential or local potential. Electrotonic potential or local potential is a non-propagated local response that develops in the nerve fiber when a subliminal stimulus is applied. Subliminal or subthreshold stimulus does not produce action potential. But, it alters the resting membrane potential and produces slight depolarization for about 7 MV. This slight depolarized state is called electrotonic potential. Firing level is reached only if depolarization occurs up to 15 MV. Then only action potential can develop. Electrotonic potential is a graded potential, refer to Chapter 31. Properties of electrotonic potential. Electrotonic potential is non-propagated. It does not obey all or none law. If the intensity of the stimulus is increased gradually every time, there is increase in the amplitude till the firing level is reached, i.e. at 15 MV. Voltage clamping. The term voltage clamping refers to an experimental method that uses electrodes to alter and control the membrane potential. Voltage clamp technique is a modified patch clamp technique, Chapter 31, applied to nerve fibers. It is used to measure the ionic current across the membrane of nerve fiber by fixing the membrane potential at a desired voltage. Principle of voltage clamping. Normally, the voltage-gated ion channels open and close in response to positive or negative charge within the cell. In order to understand the movement of ions across the membrane, ion flux, it would be necessary to eliminate the other variable, i.e. the differences in the membrane potential. It is because of two reasons: both the ion flux and membrane potential are interrelated. Differences in membrane potential would lead to differences in ion flux. So the membrane potential is fixed, clamped, at a specific level by using voltage clamp. It allows study of the ion flux through ionic channels at specific membrane potentials. Equipment for voltage clamping. Voltage clamp equipment has 3 units: recording amplifier, current generator, feedback amplifier. Recording amplifier measures the voltage of membrane potential. 2 recording electrodes, namely, the extracellular electrode and intracellular electrode, are connected to this amplifier. Extracellular electrode is placed on the outer surface of the nerve membrane and the intracellular electrode is inserted into the nerve fiber. Current generator or signal generator is used to control the resting membrane potential of the nerve fiber. The current signals generated by this instrument are passed into the nerve fiber through a current electrode. Feedback amplifier receives feedback inputs from recording amplifier and current generator and accordingly modifies the current signals that are sent into the nerve fiber, Fig 136.2. Thus, by voltage clamping, it is possible to maintain the constant membrane potential at a desired voltage. Nerve fibers used for voltage clamping. Earlier, the voltage clamp tests were done on the giant axon of the squid liligo, whose size facilitates such tests. Then the investigations were done on the neurons of small mammals. Nowadays, the tests are done on the human nerve fibers obtained from surgical procedures. Conductivity. Conductivity is the ability of nerve fibers to transmit the impulse from the area of stimulation to the other areas. Action potential is transmitted through the nerve fiber as nerve impulse. Normally in the body, the action potential is transmitted through the nerve fiber in only one direction. However, in experimental conditions when the nerve is stimulated, the action potential travels through the nerve fiber in either direction. Mechanism of conduction of action potential. Depolarization occurs first at the site of stimulation in the nerve fiber. It causes depolarization of the neighboring areas. Like this, depolarization travels throughout the nerve fiber. Depolarization is followed by repolarization. Conduction through myelinated nerve fiber, saltatory conduction. Saltatory conduction is the form of conduction of nerve impulse in which the impulse jumps from one node to another. Conduction of impulse through a myelinated nerve fiber is about 50 times faster than through a non-myelinated fiber. It is because the action potential jumps from one node to another node of Ranvier instead of traveling through the entire nerve fiber, Fig 136.3. Mechanism of saltatory conduction. Myelin sheath is not permeable to ions. So, the entry of sodium from extracellular fluid into nerve fiber occurs only in the node of Ranvier, where the myelin sheath is absent. It causes depolarization in the node and not in the internode. Thus, depolarization occurs at successive nodes. So, the action potential jumps from one node to another. Hence, it is called saltatory conduction. Salter equals jumping. Refractory period. Refractory period is the period at which the nerve does not give any response to a stimulus. Types of refractory period. Refractory period is of 2 types: absolute refractory period. Absolute refractory period is the period during which the nerve does not show any response at all, whatever may be the strength of stimulus. Relative refractory period. It is the period during which the nerve fiber shows response, if the strength of stimulus is increased to maximum. Absolute refractory period corresponds to the period from the time when firing level is reached till the time when 1/3 of repolarization is completed. Relative refractory period extends through rest of the repolarization period. Summation. When one subliminal stimulus is applied, it does not produce any response in the nerve fiber because the subliminal stimulus is very weak. However, if 2 or more subliminal stimuli are applied within a short interval of about 0.5 millisecond, the response is produced. It is because the subliminal stimuli are summed up together to become strong enough to produce the response. This phenomenon is known as summation. Adaptation. While stimulating a nerve fiber continuously, the excitability of the nerve fiber is greater in the beginning. Later the response decreases slowly and finally the nerve fiber does not show any response at all. This phenomenon is known as adaptation or accommodation. Cause for adaptation. When a nerve fiber is stimulated continuously, depolarization occurs continuously. Continuous depolarization inactivates the sodium pump and increases the efflux of potassium ions. Infatigability. Nerve fiber cannot be fatigued, even if it is stimulated continuously for a long time. The reason is that nerve fiber can conduct only one action potential at a time. At that time, it is completely refractory and does not conduct another action potential. All or none law. All or none law states that when a nerve is stimulated by a stimulus it gives maximum response or does not give response at all. Refer chapter 90 for more details on all or none law.